Welcome. Today, we're diving into a rare and often misunderstood condition, Ménétrier's disease. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. Let's begin this informative journey. The exact cause of Ménétrier's disease remains a mystery, making it an area of ongoing research. However, it's believed that an overproduction of transforming growth factor alpha, or TGF-alpha, plays a significant role. TGF-alpha stimulates the growth of cells lining the stomach, contributing to the disease's hallmark feature, enlarged gastric folds. While not definitively proven, some studies suggest a possible association with Helicobacter pylori infection, the same bacteria responsible for many stomach ulcers. The link is complex and not fully understood, but it's an active area of investigation. Now let's delve into the pathophysiology. In Ménétrier's disease, the stomach's lining, or gastric mucosa, undergoes dramatic changes. The most striking feature is the massive enlargement of the gastric folds, primarily in the body and fundus of the stomach. This overgrowth is caused by hyperplasia, an increase in the number of mucus-producing cells known as foveolar cells. While these cells proliferate, the number of parietal cells, responsible for acid production, and chief cells, which produce pepsin, actually decreases. This imbalance leads to excessive mucus production and reduced acid secretion, contributing to the disease's symptoms. Protein loss is another critical aspect. The thickened gastric folds leak protein into the stomach, leading to a condition called protein-losing gastropathy. This protein loss can cause edema, or swelling, throughout the body. Ménétrier's disease is a rare condition, affecting an estimated 1 in a million people. It can occur in both adults and children, but it's more commonly diagnosed in adult males, typically between the ages of 30 and 50. There doesn't seem to be a specific geographic predisposition, meaning it can occur anywhere in the world. Due to its rarity, accurate epidemiological data is limited, emphasizing the need for continued research and data collection. The signs and symptoms of Ménétrier's disease can vary from mild to severe. One of the most common symptoms is epigastric pain, or pain in the upper central abdomen. Patients often experience nausea, vomiting, and loss of appetite, leading to weight loss. Due to the protein loss in the stomach, edema or swelling can occur, particularly in the legs and ankles. In severe cases, this protein loss can lead to ascites, fluid accumulation in the abdominal cavity. Fatigue and weakness are also common complaints, as the body struggles to compensate for the protein deficiency and malabsorption. Diagnosing Ménétrier's disease typically involves a combination of clinical evaluation, imaging studies, and endoscopic examination. A doctor will start with a thorough medical history and physical examination to assess symptoms. An upper endoscopy, where a thin, flexible tube with a camera is inserted into the esophagus and stomach, allows direct visualization of the gastric lining. This is crucial for identifying the characteristic enlarged gastric folds. During the endoscopy, biopsies are taken for microscopic examination. The biopsy reveals the hyperplasia of foveolar cells and the decrease in parietal and chief cells, confirming the diagnosis. Barium swallow studies, where the patient drinks a barium solution and X-rays are taken, can also help visualize the thickened gastric folds. Finally, laboratory tests, including serum albumin levels, are used to assess the extent of protein loss. While there aren't distinct types of Ménétrier's disease in the traditional sense, it can be classified based on the severity of symptoms and the extent of gastric involvement. Some patients may experience mild symptoms and limited gastric changes, while others may have severe disease with extensive gastric enlargement and significant protein loss. It's also important to differentiate adult onset from childhood onset Ménétrier's disease, as they may have different clinical presentations and potential causes. The childhood form is often self-limiting and may be associated with cytomegalovirus, or CMV infection. The treatment and management of Ménétrier's disease aim to alleviate symptoms, address the underlying cause if identified, and prevent complications. For patients with Helicobacter pylori infection, eradication therapy with antibiotics is essential. Dietary modifications, including a high-protein diet, are crucial to compensate for protein loss. Medications like proton pump inhibitors, or PPIs, can help reduce gastric acid production, even though it is usually already low. In severe cases with significant protein loss and complications, medications like cetuximab, an epidermal growth factor receptor inhibitor, may be considered to reduce TGF-alpha activity. Surgical removal of part or all of the stomach, called gastrectomy, is reserved for cases with severe bleeding, obstruction, or suspected malignancy, and is not always the first line of defense. Unfortunately, there's no known way to directly prevent Ménétrier's disease, given the uncertainties surrounding its exact cause. However, some factors may play a role in reducing the risk or severity of the condition. Practicing good hygiene to minimize the risk of Helicobacter pylori infection is generally beneficial for overall gastrointestinal health. Early detection and treatment of H. pylori infection may also prevent its involvement. Regular medical checkups and prompt evaluation of any gastrointestinal symptoms can help identify the disease early, potentially leading to better management and outcomes. The prognosis of Ménétrier's disease can vary depending on the severity of the condition and the effectiveness of treatment. In some cases, particularly in children, the disease may resolve spontaneously. However, in adults, it tends to be a chronic condition that requires ongoing management. Complications such as severe protein loss, bleeding, and an increased risk of gastric cancer can impact the prognosis. Recent research has focused on understanding the role of TGF-alpha and developing targeted therapies to reduce its activity. Clinical trials evaluating the efficacy of various medications, including EGFR inhibitors, are ongoing. Furthermore, investigations into the potential link between Ménétrier's disease and Helicobacter pylori infection continue, with the goal of developing more effective treatment strategies. Advances in endoscopic techniques, such as endoscopic mucosal resection, offer less invasive options for managing severe cases and obtaining tissue samples for diagnosis. Thank you for joining us on this exploration of Ménétrier's disease. While rare, understanding this condition is crucial for improved diagnosis, management, and ultimately, better patient outcomes.